Good afternoon, North Dakota. Grateful for your presence here today, and grateful for your tuning in and keeping your curiosity up and learning more, and also grateful that you're spending a little time with us before Memorial Day weekend, one of our most sacred holidays. As we've said in recent days, we know that as we increase the amount of transmissible moments, if you will, the amount of contact with this virus, because this virus moves most effectively when it moves person to person. We know that we were going to be seeing more transmissible moments. We also knew that as we got our testing capacity up and our contact tracing capability up and doing more targeted testing, that we were going to be seeing some more positives. And again, as you've seen multiple days this week and again today, we're going to see rises in our absolute number of case numbers. But I do want to start out by saying, again, to our leaders across the state, the phase that we're in, we had a great call yesterday with mayors, county sheriffs, county commissioners, and other local leaders from across the state. And all the leaders at the local level are in the business now of managing risk because the virus is here. It's invisible. We can detect it only through testing, and there are not tens of decisions, hundreds of decisions, thousands of decisions. There's literally hundreds of thousands of decisions that are being made at all levels by businesses, by churches, by local governments, state government, to try to decide how do we manage safely the interaction between 760,000 citizens plus all the visitors that may be coming to our state. And those decisions are challenging and they're complex and they're hard to do because we have no leaders have been managed through a global pandemic like this, at least in this generation of leaders. And so again, I want to compliment all the leaders at all levels, whether it's at the school level or the park district level, decisions about opening up playgrounds and summer pools and swimming lessons and demolition derbies and racetracks and street dances and county fairs. There are just, again, thousands of decisions to be made. And I want to say that, again, thank you, because through all of this, it's the excellent response at the local level from all these organizations and individuals and businesses that has allowed us to both save lives and livelihoods. We've managed to have some of the best numbers in the nation while being among the least restrictive states. And at the same time, we've built up enormous capacity for testing and contact tracing, which has taken us ahead of nearly all other states in those capabilities, and the ability to test and to trace and isolate are not for any other purpose other than being a path for us to have a healthy and prosperous recovery. We've managed risk early on by more aggressively slowing down transmissible moments. This allowed us to build up time to build up hospital capacity, which again we've done, and thanks to all in the medical community that have participated for that, because we've got a lot of testing capacity, we've got a lot of contact tracing capacity, we've got a lot of spare hospital capacity, so we're in a position where we can continue to move forward, adding more transmissible moments and then managing that risk going forward. And that's the business that we're in right now. All of us is managing risk because there's no way to eliminate risk at this moment related to this disease. Today, the health department confirmed 90 additional cases of the novel coronavirus disease, or COVID-19. Out of a good day of testing, 2,477 total tests were completed by over the 24-hour period that included yesterday, Thursday, across all of the different participating laboratories. This brings the total positive test rate that we're reporting today, but for yesterday's test, to 3.6% among all the tests completed in North Dakota. That's slightly below our from the beginning of the health crisis forward, the 3.7 cumulative rate. And so again, that's a good space, always good to be below our cumulative rate, and always good to be in this 3% rate. That leaves us in the position of having the state with the 5th lowest percent positives in the nation. We have also completed 62,830 individual North Dakotans have been tested during this time frame, and that's again a number 2 per capita in the nation at that level. When we take a look at breaking it apart between those that were tested, newly tested North Dakotans and those who had been tested prior, we're starting to break out this data, the serial test as they're called, if someone is tested a second time. We had 926 individuals who had been tested at least one time before, and of course many of these are people that work in healthcare or reside in long-term care facilities where we've had outbreaks over the past month. This means that cumulatively, in addition to the 62,000 plus individuals that we have tested, there's been almost another 15,000 tests that have been completed by the state lab and our lab partners, so 77,447 tests, completed tests that have been done so far. When we take a look at the net case breakdown, which again is really how we think about the activity we have to manage right now, we have 860 active confirmed cases in the state. Recovered cases today were 65, and so that's a net increase of 25 over the reported numbers that were reported yesterday. We have seen out of this entire journey we've been on, 1,405 individuals have recovered, and sadly there have been 52 deaths, including one additional death, a man in his 80s with underlying health conditions from Cass County who died with COVID. Catherine and I, of course, extend our deepest condolences to this family who lost their loved one, but also to every North Dakota family and community and relatives who are grieving the loss of a loved one from this global pandemic. We are saddened as each of us can be from the loss of these 52 deaths. We have to also be reminded in a moment of gratitude that here in North Dakota that this is less than 1/20th of 1% of all the deaths in America that have happened during this pandemic. The CDC reports today that cumulative through this event, 94,000 Americans have died nationwide with COVID. And again, 1/20th of 1%, or 52 of those here in North Dakota. So again, the gratitude that we share that North Dakota has largely been spared from the ravages of this pandemic. The President of the United States issued a proclamation last night in honor of those 94,000 individuals who've passed away with COVID, asking that states fly flags at half staff until sunset on Sunday, May 24th. And in compliance with this, late last night and early this morning, I also issued a proclamation for state facilities in North Dakota to follow and match this nationwide proclamation, and that's through Sunday, May 24th. And of course, Monday being Memorial Day, the tradition there is that flags will be flown at half staff until noon when they're raised as a recognition as part of that memorial of the ongoing freedom and liberty that those individuals who gave their lives for our country have gained for us. But flags will be at half staff through noon on Monday, through the weekend for the 94,000 people who passed, and Monday morning for Memorial Day. Currently, 39 people are hospitalized. That ties our new high number set yesterday of individuals hospitalized at one point in time. This represents only about 2% of our capacity, and only about, I think the number is actually 14 of those 39 are in ICU. But for those that are hospitalized or in ICU, we, of course, our thoughts are with them and wishing them a quick and full recovery. If we look at our positive rate of 14-day rolling average, which we've done, today's rate is slightly above of yesterday. They're both listed there as 2.9, but I think yesterday was a round up from 2.85, and today we're at 2.93. So this is moving slightly up, but again, it's remained under 3% as on the rolling 14-day average, which is again relative to virtually almost all other states, a great place for us to be right now. So again, nice going, North Dakota. When we do take a look at the tests earlier in terms of that 90 tests, I do want to point out that 74 of the 90 were in Cass County, or 82% of the positive tests were in Cass County. We continue to work very closely through the Red River Valley COVID Task Force and work with officials in Fargo and Moorhead and West Fargo and Cass County and Clay County to make sure that things are going well. Contact tracing efforts are going to continue through the weekend. There's going to be some testing efforts going on conducted by the state tomorrow, and so we will again stay on guard and vigilant across the state, but particularly in Cass County, which represents the majority of our positive cases at this moment. The next topic that we're moving into has to do with additional North Dakota Smart Restart guidance. As we know, throughout this entire battle, that we've managed here in North Dakota with a great formula, and that's a light touch of government and a strong reliance on individual responsibility. We all know that it's not what government says, it's what people do, and it's the actions of individuals that prevent the spread of this virus from person to person. And with that, I would just want to also again lead with a great thanks to all of the businesses and the educational institutions and the health organizations and just families and individuals that have done a great job in adopting their lives during these uncertain and challenging and uncharted times to new behaviors and new approaches, which has slowed the spread and surely saved lives right here in North Dakota. When we entered this with a light touch, we were focused on executive orders where we did mandate the closures of certain businesses that had high amounts of transmissible activity, including places where there was high customer contact, whether personal care or other establishments. And those, again, we've opened those up. When we opened them up, the executive orders had a clarity in there that when we were reopening, that the guidance was also something that could be enforceable in terms of what they had to do. Other businesses that we never closed at all, say banks, say churches, say any of those, when we were offering guidance, it was strictly guidance. So in a measure of equity today, we are reissuing the Executive Order 2020-06 with a revision, so it'll be 2020-06.7. And in this, the guidance that was in there becomes guidance or recommendations, and we've removed all references to compliance, enforcement, and penalties to put the responsibility where it matters most. It matters on individuals, safe practices that individuals take and businesses take with their customers and team members to spread the slow of the virus and ensure consumer safety, which is, again, the path that we must continue forward on to attain our full economic recovery. By transitioning these protocols to recommendations and guidance from enforceable rules, we can ensure consistency across all categories of business types and avoid confusion when we get to the level of potentially county level monitoring, as if we move from threat level 3 to threat level 2. That could potentially change based on county by county, but this way across all business types, everyone will understand that these are recommendations and guidance. I want to also say that the language in this executive order includes the following words because, well, this is a recommendation or guidance as opposed to a rule. It says strongly encouraged to adopt and rigorously follow. So again, while we're eliminating, if you will, the legal compliance requirements with this, we remain strongly encouraging all businesses, whether you're a bar, a restaurant, movie theaters, or other gathering places, if you're in the personal care business, all the places where before we had enforcement language, that's been removed, and it's been removed because of the great work of all of you in those businesses. But again, we strongly strongly encourage you to adopt and rigorously follow the guidelines that are now there. To date, businesses have done great steps to keep employees and customers safe by adhering to the protocols, and this change will allow businesses to continue to consult with their team members and their customers and their industry groups to adjust their practices to assure continued safety and infection control in a manner that meets or exceeds the recommended protocols. This also empowers businesses to make the best and safest determination of what they need to do based on their own physical layout within their locations. Ultimately, businesses that are going to survive and thrive are those that are going to restore consumer confidence through their actions and their attention to customer needs, especially when it comes to making customers feel comfortable as we all navigate our way through this ongoing health crisis. And as we, transition from, for what some businesses was a set of legal requirements to guidance and recommendation, we must also remember that every North Dakotan has got a personal responsibility to be North Dakota smart and follow the guidelines to limit the spread of this deadly disease. I do want to close with two other thoughts. One is, one might take this interpretation is that, hey, there's no longer enforceability to these. That's just strictly guidelines and proclamations, and so we're gonna let her rip, as they say, and it's Memorial Day weekend, and let's party on. It's clear that even as we loosen up these and move from legal requirements to just simply recommendations or guidelines for those businesses that had previously during the middle of this pandemic been closed by executive order, that both the local health officer and the state health officer, between those two, they've got clear legal authority about requesting quarantines. The state health officer still has clear legal authority to close businesses that represent health risks to the public. And so again, if somebody decides they want to let it rip and there's a large breakout that's traced back to those to that either facility, whether it's a business or a place where customers go, there still is the ability, and we will, to protect public safety, take actions as needed to make sure that we're ensuring public health. So again, this is up to each business to make the smart decisions about how they restore their customer and consumer confidence, and they take actions that allow them not only to reopen, but to stay open, operating a safe and healthy business.